Serious? Doctors of Reddit, who are your dumbest patients? Hi Reddit guys, subscribe now, or I will blame you. I am an ER doc. I once had a 20-year-old and his girlfriend come in at 2 AM freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth. Saw nothing. So didn't want him to lose confidence in me. Clearly something had happened. So I'm looking. And looking. There is nothing wrong with this kid's throat. Finally I say, look. It seems okay. What do you feel or see? I don't feel it. But look, it's right there. Where? Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal. Did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Minds blown. Another life saved in the ER. I want you to know, I laughed hardest at this one. To be fair, it's arguably better to have someone come in for something they think is serious once, when it actually isn't serious, than someone not coming in for something that is actually serious. Had an old coot. Best possible description of the man, who was sweet, but had clearly spent his adult years drinking away whatever brain cells he started with. He presented with a chief complaint of, I can't drink beer anymore. Every time I drink one, I just throw it back up a few minutes later. Well, turns out Kuta hadn't been able to eat actual food in months, was subsisting on pretty much just beer, and hadn't eaten over 2 weeks. But that didn't bother him a bit, until he couldn't have the beer. Then it was an emergency. He had a big old tumor blocking the distal part of his left colon, so near the end of the road, intestinally speaking, and everything gradually got backed up all the way to his stomach. That's why he couldn't keep a beer down. There was just no more room at the inn. I fixed him with a colostomy, and he got better and left. He refused chemo and I figured he'd just go home and die of cancer. But then, almost exactly 1 year later, he came back to me with just about the same complaint. Obstructed to the point of not being able to drink beer. Except this time, it was that his ostomy had essentially retracted into his abdomen and the skin had nearly grown shut over it. He was eating out of a teeny tiny hole in his skin. What the frick? Even my oldest partners had never seen anything like it, but once again Kuta wasn't remotely phased. He just wanted us to fix it so he could go home and keep drinking. I did. Haven't seen Kuta since. I kind of hope he's still out there, treating his cancer with Budweiser and just blissfully ignoring the Grim Reaper. I met one who was taking lactulose, extra strength laxative, for her lactose intolerance. To expand on this, lactulose does contain lactose. I was an intern in the ER. I have seen a lot of stupid people. It was a small town and all. The worst I think was when I walked in, and the floor smelled like, I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably ate everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene. From his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause? The four-wheeler I was riding caught fire 6 months ago. 6 months? How had he not succumbed to septic shock by that point? MD here. If he's diabetic, a lot of patients are, and uncontrolled diabetes impairs wound healing. Then what started out as a small wound just never heals properly. Voila. Weeks, months later it becomes infected and you have gangrene. That happened to my uncle. He cut his toe one day and it just never healed. They ended up having to take the foot, and while he was recovering in the hospital he caught a staph infection, causing them to have to take everything below the knee. The worst part is getting an infection while you're healing at the hospital. Cruel it is. There was one who was very upset to find out that she was pregnant again. because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it and put it away each morning. And then her husband arrived home from his night shift. Whoa. Were her instructions not clear that she had to use it during X? Or did she just think that you can only get pregnant at night? And, pregnant again? I feel sorry for the kids. I guess not, It's an area that tends to be very undereducated. Also, this was either her 5th or 6th child, Reminds me of the urban legend about people using bananas to teach people in less civilized areas, African villages and such, about condoms. The citizens mistakenly think putting a condom on a banana, then having X beside it, prevents pregnancy. I posted this a while back when a similar question was asked. GP here. The most outrageous thing I've heard was from a boy who was something like 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night, but only under a full moon. Did you refer him to a mental health doctor? It could be a mental health problem that everyone is passing off as stupidity. What? Just, What year is this? I worked at the ER during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24H had been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. Don't you just hate it when you spend so much time and ask so many questions to get a proper medical history of the patients and it turns out they left out something really, really important? Cancers, heart attacks, etc. We had a patient come in for theater. When asked if she'd followed the fasting instructions she said yes, but luckily the nurse didn't believe her. With some prodding the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously the surgery was delayed. She's lucky to have such a good nurse. We once had a super morbid class obesity woman come in for a routine knee replacement and she blatantly lied about eating not 1, but 2 McDonald's big breakfast meals as well as 3 sausage McMuffins and several Mac's hash browns for breakfast on her way to the hospital, which her family bought her and also withheld that info for some time. She aspirated an or and went into severe ARDS. After 6 weeks on ECMO, yeah, I know, she died. They couldn't even turn her in the bed because she was so unstable. After they removed her body from the room, the mattress underneath her was basically rotted. The only time I have ever seen them throw away an entire hospital bed. Explain like I'm 5 aspiration. Severe ARDS and ECMO please. Aspiration equals some of the food in her stomach refluxed back up her esophagus and then down into her lungs. This is why you don't eat prior to surgery. Getting food, stomach acid in your lungs is very bad for you. Get pneumonia or worse. ARDS equals acute respiratory distress syndrome. Has a 20-50% mortality rate. Widespread inflammation in the lungs. The small air sacs in your lungs fill with fluid and oxygen can no longer properly move into the bloodstream. Can be treated by putting the patient on mechanical ventilation, i.e., put a tube down their throat, and the ventilator pushes air into their lungs. ECMO equals extracorporeal membrane oxygenation. When regular mechanical ventilation isn't enough because that pushes air into your lungs. But with severe ARDS it doesn't matter how much oxygen is in your lungs if the lungs are so damaged the oxygen can't pass into your blood vessels. So with ECMO they hook you up to a machine. All your blood circulates from you to the machine. where oxygen is added, and then back into your body. Basically your lungs are fricked, so the ECMO machine does what your lungs can't. If I read odds on a chart, I'm legit like, oh, this person is going to die. Had a patient who was convinced that drinking grape juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. I'm gonna stick with my plan. I really feel like it's helping. Probably the diabetics who get admitted and then get put on a diabetic diet, but eat McDonald's, Popeyes, KFC, Pizza Hut that their families bring. Usually I hate the family and the patient. This was the #1 reason why I hated internal medicine. There are few things that make me as angry and incredulous. Angredulous? I'll work on it. Then those families on shows like My 600 Pounds Life who smuggle in bags and bags of fast food right after these people have had their stomachs stapled. They wake up from surgery and there is a 2-liter bottle of Coke on their bedside table they didn't ask for. The family has put out the food on top of their prodigious bellies as though they are a living table. And of course these people have somehow failed to understand that they can't eat like that anymore. So the doctor comes in while they're eating the sorts of foods that their family has been supplying them with for years and have to deliver a big dose of reality. One of my oldest friends is a type 2 diabetic, and her family is the same way. I'm pretty sure if she were ever in the hospital they would bring her whatever crap she wanted to eat. She's always like, my doctor said I can eat whatever I want in moderation. Except, to her moderation basically means, all the time. I was about 8 when my 13-year-old brother got diagnosed with type 1 diabetes. He was in the hospital for about a week, because we thought it was a stomach bug, and kept trying to get fluids down him, sugary cokes, ginger ale, etc., and keep him fed. Turns out we almost killed him. My mum came home from the hospital once and completely cleared our house of all things he couldn't have anymore. We all started drinking Diet Dr. Pepper, and there were no more Little Debbie cakes to be found anywhere. Damn it, I rambled again. But I remember crying and hugging my brother and apologizing so hard for almost killing him. I think had someone walked in with a bunch of fast food I would have killed them. Okay Reddit guys, subscribe now, or I will blame you.